Good morning, everyone. My name is Inam. I'm from the Astana Medical University. We will discuss about intravenous injections. Let's first try to define what does intravenous injection means. Intravenous injection, it's a type of injection in which the material, usually the drug, that is directly poured inside the vein of a person. Intra means inside and venous means vein. So intravenous is a type of injection in which the substance that usually is a drug that's directly inserted into the vein of a person where it is processed. Usually certain types of the medications they are given in this way. There are many sites, like the most common site is the arm. We use the arm and there are specific veins, phallic veins, etc., so we can insert it there. But before giving any type of the medication, we should first sanitize our hands. We can also wear gloves, but we should it's better to clean our hands with the help of any kind of the sanitizer. Usually when we use a sanitizer, we can use clean our hands like this way, and then we can clean the back of the hand also like this way, and then right hand also. Then we should also clean this surface also, thumb rotation. And we should at last, people usually forget this, it's a wrist, so we should also clean our wrist also before giving any type of the medication, before touching the patients. So now let us have a look or the algorithm how it is actually done.
You can see there is a site which we have selected for the purpose of injection. We need a syringe is there, and here we are using a drug that is known as the dextromethasone. Here, as I will show you on the camera, like I will zoom it, it's a dextromethasone. Here we will use this drug so as to incorporate into the vein of a person, which is the nerve vein which is prominent there. It's already filled. I've already filled the injection into the syringe. Now if you can see the person's veins, they are it is prominent here. As you can see, it's prominent here. Before this, you can see there is an air bubble in the inside the syringe. We first need to remove that air bubble like this, so that we make sure that there is no air bubble inside the syringe. You can see there are air bubbles. Let's try to remove that. Then we need to do is, like, we need to clean the surface with the help of the alcohol swab. That's usually antibacterial alcohol swab, and we should let it dry. We should not use anything. We should let it dry by itself. Here you can see there is a vein that's very much prominent. So if a person has not a prominent vein there, he can use bed that's called as tourniquet. But the person is having a vein that is very much prominent here. Now all we need to do is, like, we need to insert the needle in a proper way into this vein, as you can see, into this vein. You can feel it like this. Now we need to insert this syringe into this vein. We need to hold the syringe 25 degrees, and then we need to insert it and need to stretch the skin, and then we need to insert it at 25 degrees into the vein. As you can see, we haven't inserted into a vein yet, like we have pushed the piston. Now there is no blood, but once you inserted it, you can see the when you will push the piston, you will see the blood coming off it, and it means that you have inserted the syringe into the vein. That's the intravenous injection actually. Then we need to push it slowly like this, slowly into the patient's body like this. Once you are done with that, like you will push it. Once you are done with that, put a cotton or the needle or the site, and then remove the injections slowly, and then exert pressure or the site where you have injected, so as to stop the bleeding. And after that, you can use the band-aid also. After this, you can use the band-aid there, and then you can throw that the syringe and everything used into the medical dustbin, so as to make sure that no one can use your injection used. Thank you very much for your keen attention. Thank you very much.